All right, so one of the measures we're going to look at is infant breastfeeding, and this is kind of a tricky one. Of course, you're not going to be asking an infant if they breastfeed because they can't speak yet, so it does involve a parent to be involved there asking about infant feeding choice at about 2 months of age. So let's take a look at the logic here. For GPRA, the denominator is looking at active clinical patients who are 30 through 394 days old, who were screened for infant feeding choice at the age of 2 months, so 45 through 89 days. How that is going to resolve is you're basically going to annotate it, and there's actually a special section that you can do that in the electronic health record. So we're coming down here to the numerator, and it's patients who are at the age of 2 months, 45 through 89 days, were either exclusively or mostly breastfed. So that's another one right there, exclusively or mostly breastfed. So when we come into the electronic health record, what we're going to do is kind of find out where that hides. So if you come in with your 2-year-old or your infant or whatever, you're basically going to come in here to the wellness tab, and you're going to come down here and you have personal health, you have reproductive factors, and you have infant feeding. Here you're going to do an update. In that update, it's going to be looking for exclusively or mostly. Those are the two that will basically, and we'll see an annotate up down here, that will make you hit that measure. So if you're you are 2 out of 4 per se, you're going to be at about 50%. And what we know about infant breastfeeding, that if the opportunity shows that the more you're able to breastfeed, it changes a lot of things in the future health of that child.